Hello everybody. Our review question this week is going to be over mechanical ventilation. So HQ challenge number 26. All of the following would be acceptable values for liberating a patient from mechanical ventilation, weaning your patient, except which one? So all of these are appropriate values when assessing a patient for weaning from mechanical ventilator, or the newest term is liberating, except, so one of these we would choose not to wean. All right, vital capacity of 1.5 liters, MIP of negative 32 centimeters of water pressure, RSBI, rapid shallow breathing index of 88, and a PF ratio of 92. So looking at all of these, if you know your normal values, you should be able to say, well, this one is okay, because it needs to be more of a negative number than negative 20. It is. RSBI needs to be less than 105. It's a good one. Now, people sometimes struggle on vital capacity because you know that critical, or a value you wouldn't wean with, would be less than 10 mLs per kilo of ideal body weight, but yet we don't have ideal body weight. Okay, but basically if somebody has a vital capacity over 1,000, over maybe 1,200, or 1 liter or 1.2 liters, it's good enough to wean with. So here we go with that. That's good enough. So it must be that PF ratio of 92. And that's the exception, because a PF ratio needs to be greater than 200. If not, there's a pretty significant shunt in the lung, and to take them off of mechanical ventilation, they may not fare as well. All right, so just by way of review, here are some of the values that we look at when we are wanting to wean from mechanical ventilation. All right, that MIP needs to be at least negative 20. We'd love it to be negative 50, but anything greater than negative 20, like negative 19, negative 18, we're not weaning. Vital capacity greater than 10 to 15 mLs per kilo vital body weight. Spontaneous tidal volume 5 to 6 mLs per kilo. Rapid shallow breathing index, where you take your spontaneous rate divided by spontaneous tidal volume, less than 105. Dead space to tidal volume ratio. This is the percent of tidal volume that does not remove CO2. So if that needs to be less than 60 to wean. The A to A difference on 100% needs to be less than 350. PF ratio needs to be greater than 200, and your PEEP needs to be less than 10. So review this slide right here. These are really important values that you're going to see over and over on your credentialing exam. Okay? Hope this helps. See you soon.